Okay, students, good afternoon. Let's begin the class with the topic of intranatal and postnatal care. This is important component of this maternal and child health chapter along with this antenatal care. So I guess hearing the word intranatal and postnatal, you can make out like as the word suggests what it comprises of. Intranatal is the care during the delivery and postnatal is the care after the delivery course. Okay. So this is the definition. It means care taken during the delivery. So it consists of the care not only of the mother but also the newborn at the time of the childbirth. So what will be the objectives for these two cares, especially for this intranatal care, that is care during delivery, is to promote clean and safe delivery and to be ready with to deal with the complications such as prolonged labor, antepartum hemorrhage, convulsions, malpresentations, and prolapse of the cord. As you might be knowing that the main chunk of the maternal mortality is like from the complications during the intranatal period. That is most commonest one will be one of the commonest is like antepartum hemorrhage, then postpartum hemorrhage also. Then we have some terms called pre-eclampsia, eclampsia. So these are the complications for which the maternal, like the main chunk of maternal mortality comprise of. So the thing is, now we'll deal with how this intranatal care will prevent these kind of complications, and also when we face these complications, how to deal with it. Okay, and then next is to recognize the danger signals and be ready to manage them. I think by now you must be knowing about the danger signs, that is danger signs of pregnancy. So there are few danger signals like specifically which deals during the intranatal period. I'll be coming into you with the upcoming slides. And then the next is to take immediate and the essential care of the newborn. Okay, then let's continue with the next objective. The next objective which I was explaining was regarding the care of the newborn. So this essential care of the newborn is like a pet question of the examiners. Okay, so you need to know like what is this essential care of the newborn and what it deals with. So by this we can this is like the basic care which is provided to the newborn at the time of birth. Okay, like which comprise of the birth resuscitation, then the care for the umbilical cord, and the care for the eyes. So coming to the clean and safe delivery, this means preventing or minimizing injury to the mother at the time of birth. So what happens? We prefer this clean and safe delivery nowadays. We prefer to be conducted in the institution. Okay, gone are the days when we used to advise for home delivery by trained eyes. Okay, this is a very old concept. Okay, the traditional birth attendant that is called DI who conducts at home during at home in rural areas. This is a very old concept. Now we specifically advise the patients to go for the institutional delivery where they can deal with any complications or be ready for any complications, thereby reducing the overall MMR, that is the maternal mortality rate. Okay, and then the room where delivery is conducted, of course, should be clean, dust-free, and warm. Then clean delivery means conducting delivery under the aseptic precautions, and safe delivery means causing minimal damage to the mother. Because previously, now of course, the neonatal tetanus and the tetanus for the mother is very low. The rate is prevalence is very low. But the thing is, before what happens, the this kind of infections like neonatal tetanus and then tetanus for the mother were very like common. Okay, so now what happens after this clean delivery was being suggested to the delivery centers, the hospitals, the almost now the prevalence is nil. Okay, for this neonatal tetanus or tetanus for the mother. Coming to prevention of infections, so how we are going to prevent the infections? Okay, so the 5 C's, there are term called 5 C's, that is the 5 cleans. We have the clean hands. Before the delivery, we have to clean our hands and of course the fingernails. Then clean surface. Clean surface is the surface where the woman is going to be laid. Okay, for the delivery. That is for clean surface. Then clean razor blade. The clean blade will be used for cutting the umbilical cord. Okay, as you know, this is the connection between the baby and the mother, isn't it? So a clean blade will be used for this purpose. Then clean ligature, that is to the ligature which is used for tying the open up umbilical cord, and then clean cord stamp. So for the clean cord stamp, uh, we say that we advise not to put anything over the clean over the cord stamp. Okay, in India there are some practices are very much prevalent, like putting cow dung over the cord stump or putting honey over the cord stump, but this is not advisable. Okay, as a medical professional, you should not advise all these kind of stuffs which will promote this infections. Okay, so these are the 5 C's. This is important for you. So, in order to observe these 5 C's, what happens? The health department used to give the mother before just before the delivery. They used to give a kit. Okay, we call it as the DDK. That is the disposable delivery kit. In order to promote this 5 C's. Okay, the contents will be comprising of a gauze piece, ligature, razor blade, soap, antiseptic lotion, cotton. So these will be used to promote all these 5 C's. Okay. So next, so how these are kept? All these contents which are available, which were mentioned before, are to be placed in a plastic bag, sealed and sterilized by the gamma radiation. Okay. So coming to the domiciliary care, this is just for discussion purpose. We are not supposed to promote domiciliary care anymore. Okay, domiciliary delivery may be advised if there is a normal obstetric history, adequate ANC, availability of a trained dye and condition at home are helpful. This was advised before. Okay, if at all these conditions were favorable, that is the woman didn't have any like bad obstetric history. She gives a totally normal obstetric history, no history of any abortions or any prolonged labor before, or any postpartum hemorrhage before, or any antepartum hemorrhage before. Okay, and then the adequate number of ANCs, then availability of trained birth attendant, this trained birth assistant we say, and condition at home if it is favorable. So these some of the advantages and disadvantages of this domiciliary care is the mother will be delivering, of course, in a familiar surrounding, and then this may tend to remove the fear associated with delivery in a hospital. And then also one of the important advantage of this domiciliary care, we used to say that the chance for cross infection from other patients will be very low, and then also the mother is able to keep an eye upon her other domestic affairs or her children, causing less mental tension for it. But the thing is, the benefits are less compared to the risk. Okay, the risk will be more. That's why nowadays we don't go for domiciliary care. The disadvantage will have, of course, no one will be there. Of course, the if at all the third trained birth attendant is also there, she might not be able to face complications like postpartum hemorrhage or prolonged labor or any other complications. So thereby, so these were the like main reasons which contributed to the maternal mortality. Okay, and then the mother may have less rest. Of course, she will be at home with her kids. She won't be having any adequate rest. Then, of course, she may resume her domestic duties too soon and her diet will be neglected. So, coming to the danger signals at the time of the delivery. So these are the danger signals. That is the obstructed labor, that is the labor where they have good pains, okay, but there is no progress. So there will be no proper dilatation of the cervix, okay. Although the pains will be proper, although the contractions will be there will be no dilatation of the cervix. Then next one is the sluggish labor pain for more than 24 hours. That is the prolonged labor as we suggest, and then bleeding during the labor, then prolapse of the cord or hand, meconium stained liquor or slow, irregular or excessive fast fetal heart. This we especially is very like scared of it. Okay, meconium stained liquor, because once the liquor is stained, that means there is some amount of fetal distress inside. Okay, and then that means we have very less time to act upon. Then collapse during the labor, then placenta not separated within half an hour after delivery, that is the prolonged third stage of labor we say, and then hyperpyrexia. Pyrexia, as we suggest, the temperature of more than 38 degrees Celsius or over during the labor. Okay. Now coming to the institutional care. Before we used to say that institutional care is recommended to only the high risk cases and where home conditions are unsuitable. But now the concept has changed. We used to advise institutional care for everyone, okay, irrespective of the high risk cases, irrespective of the conditions of home. We used to advise institutional care to everyone. So the mother is allowed to rest in bed on the first day after delivery. So normally, after normal delivery, usually we used to discharge the woman after 48 hours of delivery. Okay, that is the normal thing, normal concept. There are a few terms called the rooming in or bedding in. So keeping the baby's crib by the side of the mother's bed is called rooming in, and the word, as the word suggests, bedding in is in the keeping the baby in the same bed as the mother. Okay, so there are advantages for this rooming in or bedding in. First of all, this creates a bonding between the mother and the child. Okay, which is very essential for lactational purpose also. Okay, then mothers interested, of course, in breastfeeding usually find that there is a better chance for success with rooming in, and also it allays the fear in the mother's mind that the baby is not misplaced in the nursery. Then coming, so that's all for the intranatal care. You have to be thorough with the 5 C's which I mentioned, that is the 5 cleans, okay, and then questions regarding this rooming in also used to come, okay, and then you have to know all these danger signals. So these are basically the important components of this intranatal care. So coming next to the postnatal care, as the word suggests, of course, the care during after the delivery. So like I mentioned before, this will comprise not only of the mother, but it will comprise also of the care of the newborn also. So the objectives of the postnatal care are to prevent complications of the postpartum period. So can any one of you say what may be the complications for the postpartum period? Any idea? What are the complications? What may be the complications in the postpartum period, that is the period after the delivery?
hemorrhage,
Yeah, we call it postpartum hemorrhage. And then anything? Yes.
peripheral sepsis,
Okay. And any more? Can you suggest?
infection, infections,
Okay. That is same like peripheral sepsis. Okay, fine. Let's continue. So, to prevent complications of these, which we have already mentioned, then to provide care for the rapid restoration of the mother to optimum health, then check adequacy of breastfeeding, then provide family planning services, that is, to provide an advice for the family planning services, and to provide basic health education to the family as a whole. So these are the complications, that is puerperal sepsis, that is infection of the genital tract within 3 weeks after delivery. Okay. So what may be the symptoms for sepsis? General symptoms will be rise in temperature, isn't it? And with along with tachycardia, that is increase in pulse rate. Then foul smelling, lochia. Lochia, I guess you know by now, lochia is the discharge, okay? Discharge which comes out after delivery from the genital tract. Usually it stays like it starts straight after the delivery, and it may last the till 3 weeks, okay, till 3 weeks after delivery, or sometimes it can last more also, okay. And then signs will be, there will be tenderness in the lower abdomen. So the next complication is the thrombophlebitis. This is also one of the causes, like one of an important cause for maternal mortality, that is thrombophlebitis. This is infection of the veins of the legs, frequently associated with the varicose veins. This thrombophlebitis is actually very common in the patients who undergo cesarean section. Okay, the legs may become tender, pale, and swollen, and as it is mentioned, that it is usually due to immobilization of legs, that is, following prolonged bed rest after the delivery. And then coming to the secondary hemorrhage, that is postpartum hemorrhage, that is bleeding from vagina anytime from 6 hours after delivery to the end of the puerperium. That is the 6 weeks. Okay, and this may be due to retained placenta or the retained membranes. And then other problems which might be faced are UTI. UTI is also common after delivery. Then mastitis. Okay, this mastitis can of course be prevented by expression of milk as soon as there is breast engorgement. This breast engorgement is also like a common complaint given by the mother. Okay, after the delivery. So, how we are going to restore the mother to optimum health is by giving regular postnatal checkup and postnatal advices. So, these postnatal checkups in both institutional and if at all there is domiciliary delivery, we used to advise there should be, we advise for mandatory postnatal checkups. Okay, if at all the woman delivered at home, we used to advise that there should be mandatory postnatal checkups from the ASHA or the ANM of the locality. Okay, and preferably this first postnatal visit should be conducted within this 24 hours of the delivery. And then, what is actually done in the first postnatal checkup? The first postnatal checkup comprises of a general physical examination, that is the checking of the vitals, that is the pulse rate, BP, okay. And then coming to the per abdomen systematic examination, that is assessing the involution of the uterus. We say that the uterus after the delivery should come at least till the level of the umbilicus. Okay, if at all it doesn't come at the level of the umbilicus, we suspect there are either retained membrane or retained placenta. okay, or there is problem with the involution of the uterus, okay. And then, of course, examination of the site of episiotomy if conducted, and examination of the lochia, okay. And then it will be the breast examination also will be included with it. Then the second visit, that is the second postnatal visit, will be on the third day, and then the third visit will be on the seventh day. We say total that zero, the day of the delivery, then the third day, then seventh day, and then the 14th day, 21st day, 28th day, and 42 days of birth will be considered for the postnatal checkups. Be thorough with this postnatal checkup visits because these are asked usually for your viva purpose. Okay, and then there are significance why these visits are made, particularly during this third day, seventh day, 42nd day. Okay, you have to know about it. So third day is basically to see if at all there is physiological jaundice. Okay, for the baby, of course. Physiological jaundice, of course, you might be knowing that it is very common for the newborn, isn't it? So if at all this physiological jaundice persists beyond this third day, then we'll be terming this as pathological jaundice. Okay, and then seventh day will be assessing the umbilical cord of the child. Okay, by seventh day, that is the first week of life, the umbilical cord usually shrivels and comes out. Okay, if at all it doesn't come out by the seventh day or beyond seventh day, that means we can suspect some amount of infection over there. Okay, and then we'll be asking about the bleeding per vaginum or foul smelling discharge, because if at all the lochia as such is like physiological. Okay, we have three types of lochial discharge. You will be knowing more in your obs and gynae classes. So if at all this lochia starts to becoming foul smelling, we suspect some kind of infection. Okay, and along with it, we'll be assessing this breast tenderness and pain, or at all, or fever at all. Okay, and then previously only 4 visits we used to say that it's mandatory. Okay, that is the first day, that is the day of delivery, that is the 0 day, third day, seventh day, and last is 42nd day, that is the last day, that is the end of the puerperial phase, we used to say. Okay, but now we have added this 3 more visits. Okay, this is the 14th day, 21st day, and the 28th day, and along with it the 42nd day. So these days are also added. This is for like checking whether the baby is growing properly, is it having adequate weight gain, or the adequacy of lactation, whether the baby is taking feedings properly or not. So these visits are added because of it. Okay. Then the next, coming to the postnatal advices. So some of the important advices the mother is given is about the nutrition, because as we know, both the pregnant woman and lactating mother needs additional calories, isn't it? So during the lactation period, the woman needs actually more calories during even the antenatal period also. So here we say that during the first 6 months, the woman will be needing additional 600 kilocalorie. Okay, and then for the next 6 months, the woman will be needing 520 kilocalorie. And then she is advised on a light diet on first day, then diet rich in calories, proteins, iron, calcium, and vitamins. And then next, the advice will be on the personal hygiene, of course, to prevent the infections. Then advice given regarding the rooming in. I think you must by now you must be knowing the term called kangaroo mother care. Any idea what is this kangaroo mother care?
Ma'am, I think it is keeping the baby
Ma'am,
near the stomach. I don't
Not
know.
only stomach, it's just a skin to skin care. Okay, so
Okay.
as the word suggests, kangaroo mother care. So can the father give this kangaroo mother care?
yes, ma'am.
Yes, I think because even father can keep the baby attached to his skin.
Okay, okay, fine. The even the anyone can give this kangaroo mother care. This is basically to prevent hypothermia. Okay, hypothermia is like very common for the newborn, as it takes time to adapt to the general conditions, isn't it? Because the inside temperature, that is inside the mother's womb, the temperature is much more than the temperature outside, isn't it? So this kangaroo mother care we advise basically to prevent this hypothermia. Okay, and then next one is comprising of advisors for the breastfeeding. So this regarding breastfeeding, the medical professional will be getting the maximum complaints. Okay, the initial days, mother will be complaining of not enough milk. Okay, this is one of the commonest complaint which is given by the mother to the doctor. So what you need to advise is that whatever it comes out during the initial phase, basically we say that is the colostrum, isn't it? The first milk for the baby. So this, the amount, whatever it comes out, it is very much sufficient for the baby. Although she thinks, she might be thinking that it is very less. So can we give some extra like milk from the from the packeted milk, of course. So that you have to counsel the family and the mother that sufficient amount of colostrum, whether it looks less, whatever less or more, this will be adequate for the baby, and she has to continue the suckling. The baby should suckle. Okay, continue suckle. This will be like increasing the, this is like somewhat called the lactational reflex. Okay, more the suckling reflex will be there, more amount of milk will be produced. Okay, so usually in our Indian scenario, we have seen that this colostrum is usually discarded. Okay, thinking that it is bad discharge or bad milk. But the thing is, we have to advise or counsel the patient party that although it looks yellowish, this is not bad. Okay, this thick milk is the first milk which the baby should be having. Okay, because this is very rich in protective antibodies. Okay, then there are practices of giving prelactal feeds also. In Indian scenario, we have seen that this honey is one of the favorite components for this prelactal feed. But lots of disadvantages are associated with the prelactal feeding practice, and we have to discourage this practice. Okay, then exclusive breastfeeding, that is only breast milk and not even water, must be advocated or advised to the mother for the first 6 months. And after 6 months, we have to advise that she can start giving the complementary feeding. And this breastfeeding should be done on demand. Okay. At the age of 6 months, breast milk, as I have already mentioned, should be supplemented by additional foods. Okay, and then how to check for adequacy of breastfeeding. So there are few signs by which we know that the child is getting adequate breastfeeding. One is the proper gain in weight. Okay, the weight gain will be adequate for the baby if at all he is having adequate breast milk. And the next is he will be passing urine around, like the average amount of passing of urine will be 8 times per day. Okay, so if at all this is less, If at all he or she is passing urine 2 or 3 times in a day, that means he or she is not getting adequate breastfeeding. And then after the feed, the baby will be relaxed. Okay, either he will be sleeping, but at least not crying. If at all the child is continuously crying and even after feed the child is restless, that means he or she is not getting adequate breast milk. Okay, and then the amount of stool also. The stool also will be for the newborns. The stool is not usually not solid. Okay, but if at all the child is not getting adequate breast milk, the stool will be hard. Okay, and then the postnatal advices regarding the family planning methods. So you have to advise the family, that is mainly the couple, to at least go for 3 years gap. Okay, 3 years gap they should at least have for the next baby, and if at all they want to terminate this, I mean they want to go for terminal procedure, you can give advices regarding this terminal procedure, that is regarding the laparoscopic tubectomy and NSP also you can suggest. Nowadays there are schemes for this family planning where they usually get money if they go for this family planning methods. Okay, and then you can suggest for this postpartum IUCD, PPIUCD as we mentioned. These are all the spacing methods. Okay, and then usually we don't advise this oral pills, that is the Maladi or Mala N to the lactating mother, because these hormones will be suppressing the lactation. Okay, and then this birth spacing, as I have given importance to this word, that is the birth spacing. Why there should be birth spacing of at least 3 years is that in order to decrease the risk of maternal complications, which is due to the depletion of maternal reserve of iron, calcium, and other essential micronutrients. Because after the this delivery, mother tends to lose a large amount of blood, isn't it? So, and usually the Indian women, they almost half of them suffer from iron deficiency anemia, and additionally after delivery they become more anemic, isn't it? So in order to be prepared for the next pregnancy, they should be like adding uh, like uh, adding to this reserve of iron and other essential micronutrients. Okay, this prevents, in general, we say that prevents maternal depletion, that promotes general health, then promotes health of the child, that is, she can take care of the child which is already being born, then reduces the maternal and morbidity and mortality, because most of the maternal morbidity and mortality in the Indian scenario is because of iron deficiency anemia, and then reduces the incidence of low birth weight. This is also one consequences of iron deficiency anemia of the mother, that she used to give birth to a low birth weight child. Okay, and then in turn reducing perinatal and infant death. And then we can advise them of some postnatal exercises which will restore the ligaments and tissues and muscles back to the pre-gravid state, and then advices regarding when can she resume sexual intercourse, and then also one of the most important component comprise of the immunization of the baby. Okay, so that's all for today's class. This is a very important chapter for this comprise of mainly the Viva questions. Okay, so you need to be thorough with this postnatal care and then intranatal care, and of course this ANC cases you people used to get for your family visits, but along with it you will get questions for intranatal and the postnatal care. Okay.